أسماءكم. عرفت ميان، جننت
أنا
بصالحة أمس، ومن بعد
أنا أسامة.
أسامة. أسامة اللي ذيك اليوم.
أيوة.
أنت الهوستينج هذا الموضوع كامل شغلك. عرفت ميان،
أنا هوستينج زوم.
جننت بصالحة أمس، ومن بعد
أنا أسامة.
أسامة اللي ذيك اليوم.
أيوة.
أنت يلا بسم الله.
أوكي سوري، كنت فاتح اللايف فتكرر الصوت. كنت أقول إنه أنا هوستينج زوم يعني.
طيب
شكرا. زين، نحن لايف، إذا حابين تبدأوا فتوكلوا. ميان.
أسامة تقدر تفتح الكام مالي، صار عندي مشكلة.
زين لحظة واحدة.
أوكي.
قصدش البرزنتيشن؟
لا my cam. You can do it from.
أنا أقدر أسوي ask to start video.
لأن أوكي يصير أطلع وأدخل.
أيوة يصير.
Okay, it's fine now. Okay.
أوكي، والدكتورة بعد.
Okay. Sorry.
لا ما طيب.
أوكي. كيفش ميان؟ شفت
Okay. So good morning everyone. Coming toward our day, I'd like to introduce our guest, Dr.Adhari Zaabi, who is a medical doctor and a researcher in cancer sciences. She got her MD degree from Sultan Qaboos University, and she was the first Omani and Arab woman to be chosen to be in HOPO International Organization, a member in HOPO International Organization. That she is concerned with focusing on clinical research, focusing on clinical research in the field of human protein and the molecular structure of human body proteins. So help me to welcome Dr. Adhari, one of the best doctors.
أهلا ميان، كيفش؟ نفختين كثير تراش.
Okay, Doctor, you want to say something ولا أكمل؟
والله أول شيء أنا أريد فعلاً أبين لأي درجة أنا فخورة بهذا الجهد، يعني ما شاء الله عليكم من أسبوع إلى الآن مجتهدين اجتهاد غير مسبوق، ما شاء الله عليكم. الموضوع جداً شيق، الحوارات جداً رائعة، وإدارتكم للموضوع ابتداءً من التنظيم لأن دائماً الأونلاين في مشاكل، وما شاء الله عليكم you were handling it very well. صح أنا ما حضرت كل السيشنز، لكن whatever I attended it was very impressive. بالتوفيق إن شاء الله، وأتمنى اليوم يكون حوار شيق جداً.
شكراً. إن شاء الله. Okay, so what do you think? Can artificial intelligence replace human in medical field? Let's see. As we all know, every topic has opponent and supporters. So let's start with Hiba, who will share her ideas about artificial intelligence and human in medicine. Welcome, Hiba.
Good morning, everyone. Are you able to hear me?
Yes, clear.
Share my screen.
Yeah, everything is up.
I think you can see my screen right now.
Yes, clear.
So my name is Hiba. I'm a seventh-year medical student at the National University, and I'm going to explain why I think artificial intelligence can take over in the medical field. And I guess I shall start. Okay. So this is just a simple chart I wanted to show you guys because it includes the different fields in medicine where AI can be implemented or have been implemented already. The only difference is that it's not independently working. There's still the human or the doctor aspect in it. So I'm going to be using some of these as examples throughout my discussion. Okay, so my first point is that artificial intelligence can help us decrease the workload on healthcare professionals. So if they have less workload, it means they have more patient face time and more time on critical cases. I would like to support this point with a study that found that physicians spend around 27% of their office time directly interacting with patients, while they spend almost 50% of their office day on electronic and hospital records and desk work. I'm not even blaming doctors. Throughout my clinical training last year, I've seen how hard it is to balance between giving your patient the attention they need and carefully listening to them, while also taking care of entering data on your computer. It's such a hard work to do. All right, so moving on to the next point. Using AI algorithm can increase efficiency, accuracy, and precision. Now, this can be explained in two ways. Using the algorithms can help doctors be more efficient and more precise and more productive, because if we have more programs that use AI intelligence, it will free up the doctor's time to focus on cases that cannot be solved with the computer, and hence increasing their productivity. And it's not just doctors, also all the healthcare professionals, nurses, and everyone else. The other way to explain it is that there are certain algorithms that have proven to be more accurate and more precise than humans. And I don't know if you guys remember in one of the presentations throughout the event when Dr. Zahid, I think, he told us an example about an ECG reading algorithm. They had some ECG samples and they gave it to cardiologists and they gave it to the algorithm as well. Cardiologists said that, well, this ECG looks fine. These are some minor changes. Patients is fine. And the algorithm said, nope, I think this patient is facing the risk of death within the next, I don't know, 3 months, 3 years, I'm not even sure. And when they did the follow-up, guess what? The algorithm was correct. Even the programmers didn't know how that happened, but it happened. My other examples is the lymph node assist. It was developed by researchers at Google AI Healthcare. Now, this is an algorithm that is able to analyze histology samples of lymph nodes, and it is supposed to identify metastatic breast cancer in the lymph nodes. And the algorithm was accurately classifying a sample as cancerous or non-cancerous, and it was correct 99% of the time, which is a very good number. My next example also is the deep learning based automatic detection. It's also an algorithm developed by researchers at Seoul National University. And this is supposed to read chest radiographs and also detect if there are any abnormal cell growth indicating potential cancers. The algorithm was able to outperform 17 out of 18 doctors, which I think also a very good number. And moving on to my next point. Okay, this is just an example of the algorithm that is able to read the histology slides. Okay, my third point is that using AI in the medical field can help us save time. And again, by saying AI in the medical field, I mean using it as an independent entity. So assigning a full task to artificial intelligence can in fact help us save so much time. How many times did you have the doctor appointment and you had a very busy and a tight schedule and you weren't able to attend, so you just missed the appointment? On the other hand, your doctor had a very full list. They couldn't reschedule another appointment for you in less than, say, 2-3 months. And how many times did you have a medical condition and you just didn't know if it's critical or if it's important to see a doctor about it, or if it's just a self-limiting condition, it will go away on its own? So I think there could be phone applications, smartphone applications that can help you assess your symptoms, because, well, Google is not very good at assessing your symptoms. Googling having rash, and then Google will tell you, oh, you have a rash, you're going to die in 2 days. That's not very cool. So I think having something more reliable that works based on certain algorithms that can tell you about your symptoms, it can refer you to a doctor's office if it's important, and then it can do some follow-up and advice on your health. This has been implemented in the UK. There's actually an application called Babylon. This application can help patients consult their doctors online and check for symptoms and also get some advice and follow-up. My next point is extra attention and personalized protocols. Okay, so imagine if you as a doctor is able to use an application or a program and fully assign the task of collecting data, the patient data, analyzing it, and also giving you some insight about what the patient might need, their medical needs. It can definitely help you personalize a protocol for that particular patient. Another example is they're trying to develop an algorithm that is able to detect some behavioral changes with some sensors. And they thought that could be beneficial for elderly people who live alone. So imagine with me having someone elderly living alone, they're diabetic, and they often experience hypoglycemia episodes, let's say. And okay, let's say they also developed hypoglycemia unawareness, meaning they're not able to identify when they have the symptoms so that they can go and consume more carbs or glucose particularly. So imagine having an algorithm helping you to know that, oh, you're getting hypoglycemic, your behavior is changing, you're getting more agitated. I think you might need to go get some sugar. Or maybe the algorithm can contact your neighbor, your doctor, or anyone who's able to take care of you so that they can come and give you some help. I think that would have been very beneficial. My next and last point is distance therapy. Of course, when we talk about health, it's not just the physical health, we should also consider the mental health. Distance therapy is, there's an example for that. It has been implemented right now. It's a legitimate website and I was so curious to check it out. It's called AI Therapy, which has an online course to help those with social anxiety. I don't know how reliable the website is, but y'all can go and check it if you're curious about it. And I think this can be very beneficial because you cannot imagine the number of people in my life that require support and therapy and they're not able to get it for so many reasons, like, well, I don't have a ride, I can't see my therapy this number of times a week, or maybe I like a therapist or a certain doctor in Muscat and I don't even stay in Muscat. I'm in Suhail most of the time because I study there, right? So imagine if we have distance therapy, and also imagine if we have that during the pandemics, since I think so many people haven't been able to continue their therapy throughout the pandemics, and then they have to switch to online therapy where they communicate with their therapist online. So if we don't have to have the therapist working, we can just use an algorithm that can guide people through the journey. And that is it. I think it's very promising, but I also think it's very scary. It's a new technology. There's so many legal and ethical aspects to be considered, but I hope we can use it in the future. And that's it.
Thank you, Hiba. Khadija, who is an opponent to this point, will share her ideas now. We can get some questions for Hiba till Khadija comes. Anyone has questions?
Can I say something here?
Yeah, sure.
Very well done, Hiba. I like the way you presented. So it seems you are medical student. You are surpassing medical professional in constructing PowerPoints.
Oh,
so it was to the point. It was not like full of information, unneeded information. It was really very, very attractive. So I think it's better to wait for the other opponent in order to be able to have more fruitful discussion. So yeah, just let's wait for her.
Okay, so Khadija is here in the meeting. I think she will not use her video. So Khadija, are you there?
Yes, I'm here. Can I share the screen?
Yeah, sure. Just a second. Yes, you can now share your screen. Is everything all right, Khadija?
Give me 1 minute. So it is clear for everyone, the screen?
Yeah, clear.
So can I start, Dr. Adhari?
Yes, sure, we are excited for your talk.
Thank you very much. So our topic today is, can artificial intelligence replace human in the medical field? My answer is no, and I can give many reasons for that. Let's start with the thing that we grow up with and we learned in our medical school, which is communication skills and the relationship between the physician and the patient. And in this relationship, we have to show empathy. We have to show the understanding for the feeling of the patient, the way he like express his feeling and the way he describe his pain or her pain. And also, let's focus if this is a psychiatric problem. How can a patient talk to a machine or talk to a computer or to a system? They always need this relationship, which I think that this is a weakness in the system, that it can build this relationship. Moving to the miscommunication, as I mentioned before, one of the most important things in the physician-patient relationship is the communication, the good communication, the good communication skills, and how we as doctors take the history from the patient and understand what is the real problem. So the system is directed in a way that it's only understand whatever data given in. So how can this system understand whatever languages they are or whatever type اللهجة, I mean, يعني it's different from person to another, which us as doctors face certain problem at the beginning. By experience, we get much better in communication. So how can the system face this problem, and how can it solve it? How can it be solved? Sorry. Those two points bring us to the big data in health care, because as we know that there is a long journey with the history that we have to go through it in order to get up with what lab results we have to do, what are the differential diagnoses, and then what are the best treatment for this patient. And also, not only what is the best treatment, we can know the treatment, but we have many different drugs and many different brands for these drugs. So how can the machine start and give the priority for this drug, not the other? It's a big decision. So the decision making is one also of the weakness in the system, I think so. Moreover, the system is depending on the feeding data. So how much you feed this machine, how much you will gain from this machine. So we always need to feed this machine. And by mentioning this point, so this means that we always need a human to feed this machine. And a human will take this data from the patients, from the resources, from the health center, and then feed it to the machine. So this is again means that in medical field, we can't at all replace human with artificial intelligence. Again, decision making from all of those points I mentioned, we have to take the decision in which diagnosis it is and which treatment we have to go through, which lab investigation we need. So this decision making, how can the system do like make it? And also in signing LAMA, how can the system understand if the patient is well educated and like understand the case in order to sign this LAMA? What about if the patient answers the question of the age differently and then he's below 18, or if he's too old to give this decision, or he's having any other mental illness? So the decision making and signing LAMA also one of the weakness in medical field. Moving to the Gartner hype cycle. Gartner hype cycle for the artificial intelligence will take a long period till it reached to the plateau of productivity, which means that the system now can act with its own, and it can show the efficiency of the system. And this can take many years, and we don't know how many years it can take. It can take around 5 to 10 or even more than 10 years. So this is a very long time that we have to wait for this system till it get productive, till it be productive. Not this only, but also what about if we were waiting for this system and then other system is developed? So which one you have to choose, and depend on what you have to choose. So this will be time consuming, and this will be very high cost. It will hospitals have to get the systems as soon as they developed. So this will cost high high costing for the hospital and for the health system. And then what is if there is any technical problem or system problem? Then this also will need certain time and will need trained people to fix this machine, because not everyone is accessible to this machine and can deal with it. But if the physician have a certain thing and he's on a sick leave, for example, or he can't do, or she can't do this shift, we can call the other doctor or the other physician in order to take her or his place. Moreover, the complexity. As we know, those machines and those systems need person who's trained to deal with them. So how can we, in medical field, we have patients in different ages. So how can you train pediatrics or train adult, older people in order to deal with this system? So always we need someone who is trained to deal with this system. And if we always keep one who is trained to overlink with the system and with the patient, then again we're in the same point that we can't replace a human with artificial intelligence in medical field. Again, the collaboration space. As we know, there will be many systems, there will be many computers, there will be many for example, now we have Apple and we have the Android. So there is certain problems or certain difficulties in communication between those two systems. So what about if there will be many brands, many systems, how those systems can communicate with each other? Now in our days, as a patient, he or she have the right to search for other opinion from other physician. But if it's on system based, how can they go for other system, and which system they will trust depending on what? So this is, I think, one of the weaknesses. Again, errors. We do have medical errors as a physician, and I do believe that we as a human do errors. But in this case, in our case today, nowadays, we will blame doctors, we will blame physician. But if there is a medical error with the system, then who to blame? You have to answer this question yourself. And finally, even though we ignore all of these weaknesses in the system that I mentioned, how can the patient or the society trust that the machine will take care of their health and will solve their medical issue or medical problem or their disease? I think this is a stigma in the system, because it's very difficult for the society to believe in a machine. They don't believe also in the doctors who is certificated and who go through a long journey in order to become a physician. And they go to many doctors in order to just decide if they will go through this procedure or through this operation or not. So how can they trust a machine? And here I come to the end of the presentation. I will end with that I do believe with And I do agree with many points that Hiba said about that it's make our lives easier, and it like save doctors' power, doctors' time, and in order to be more efficient, in order to help physicians to be more efficient and focusing on their works. I do believe in this, but artificial intelligence made to make our lives much easier, not to replace a human, because how can something made by a human replace a human? And about the point that Hiba mentioned about the algorithm, it was correct in the ECG example. I think this happened by luck, and we can't trust luck in medical field because they don't know till now how this happened. So I think we can't trust one luck in this field. So that's all. Thank you for listening.
Thank you, Khadija. And now Dr. Adhari will review the shared point and will give us her opinion about the topic for 15 minutes.
شكرا خديجة وشكرا هبة. I really love the way you were defending your points. Actually, both of you are right. If you noticed, Hiba was mainly mentioning the areas in medicine that AI can help in, where like ECGs, X-rays, skin diagnosis, pathology reports, and these are the fields that basically have more of what is it called patterns. And in medicine, you can divide medicine into science and art, as we mentioned in the opening ceremony. And if you take the science involves like knowing all the knowledge about medicine, how to link symptoms with signs, how to see like under the microscope what are the things that particularly you are looking for in CT scans, in X-rays, on histological slides. And if you gather them all, you will see one thing in common. They are all having patterns. So you can teach the machine that if you find A, then followed by B, then by C, then by D, then this is the diagnosis. And if A was followed by, for example, M, then L, then O, then this is the diagnosis. This is not hard at all for machines to handle. And this is what is happening if you follow the slides of Hiba. So what she mentioned is right, that these areas or these specialties will be hugely replaced or assisted hugely by AI algorithms. And this is why if you see all trendy like AI applications, all FDA approved, are toward these subspecialties. They don't touch, for example, emergency. Emergency department was not touched, but triage system was touched because triage goes with this hierarchical like things to follow, and there is a protocol. But for example, if a patient was, for example, burned in a fire, or if a patient has a road traffic accident, this is a very emergency and it needs immediate act, and no machine till now, and maybe in the next 20 years, no machine can replace human being fast act in such situation. What Khadija was mentioning in terms of like empathy, reaction, interaction with patients, and psychiatry, although psychiatry was hugely replaced by chatbots. I will tell you the example. But she was mentioning the art of medicine. Art of medicine will never be replaced by a machine. But what they did, for example, in psychiatry, in one of the American universities, they replaced the chatbots in the waiting room, where the patients, some of the patients, they don't want to share their experience or their emotions or their psychiatric problem with a human being. And they will feel very, very open to discuss all details, private things about their life with a machine rather than with a human being, because they are afraid of stigma, for example. So despite it is basically pure art where you listen, you discuss, but it was indeed replaced by a human. And they saw that these patients were behaving very much, and they were responding to behavioral treatment more than patients who were just avoiding disclosing private issues with their psychiatrist. So again, it goes all toward the root of medicine, science, and art. But if you go to the science again, even the diagnosis, like, I don't know how many of you are in clinical years, but you can see diagnosis is not straightforward. You will have patients, as we said, for example, have patient with diarrhea coming to emergency department or going to the health center, where they all be having the same exact diagnosis. Even if you apply the protocol, you will face cases where at the end of all history and examination, you don't know that you don't have a diagnosis. You will just treat empirically, or you will treat as what is common during that period or season, but still you don't have a diagnosis. Machine will have struggle tackling such cases. So what I believe in, AI will not replace doctors, but it will reorganize their job. So it will organize where they are much needed. So for example, if we say the first, by the way, they are predicting the first medical field that will be hugely affected by AI is radiology and pathology, because basically they are dealing with images, and what they are applying is pattern. They are looking for example, mitosis, angiogenesis, irregularity in cell shapes, and these are very easy to feed into the system. Plus, on top of that, there are a lot of data to feed the systems in these two fields. So for a radiologist, it is for sure, for example, let's say this example. If a radiologist sees about 100 X-rays, chest X-rays in a week. So now with the help of AI, maybe he will see maybe 40, because the other 60 will be seen by the AI and it will be labeled as normal. So now his time will be mainly for the abnormal X-rays in order to look at and to figure out why it is complicated and why it was excluded by the AI machine. The other way around, maybe AI will reach a stage where it even can diagnose all X-rays, like all the 100 X-rays, it will give very accurate diagnosis. So now the radiologist's job will be to link it with the clinical parameters and find more accurate diagnosis. So now he is still a radiologist. He's like looking at chest X-rays, for example, but his main role will not be to look at the X-rays, very simple X-rays, finding the patterns that he used to look for, but now he is more using more of higher order, cognitive skills, rather than just linking the patterns toward a diagnosis. This is one. For pathology, if you go to pathology department, you will see how long do they take and how much time they are spending in front of their microscopes. And these reports are very much needed in the clinical departments in order to proceed with the treatment. So you see the pathology reports, sometimes they take weeks, and the patient will be waiting for that pathology report in order to know what is his future, what will be the plan. So now with the AI, it can very simply, for example, breast cancer, as Hiba gave certain examples, and it was proven very powerful. It can diagnose breast cancer with its subtypes and its genomic profiles basically in a matter of minutes. So you see how fast it will react. So now someone will ask, okay, what will be the role of pathologist then? So the pathologist, his role will be like to decide in which patient will apply immunohistochemistry, for example. Or if there is a doubt and in connecting the pathology report to the clinical data, they don't fit, then he can go back and re-evaluate the slides, for example. So these image-based or pattern-based fields, medical field, they usually will be affected, but they will not be replaced. This is why what I said previously, people who are willing to be diagnosed or specialized in these fields, they should look for institutes that really change the way of training in these specialties. If the training is similar to the training that we received, me and my colleagues, then it will not help in the future, because you will struggle. After 5 to 10 years, all medical fields practice will be different. So training should be different. And from now, you should be prepared for it. And I see all of you, mashallah, you are getting that flavor of how AI will impact health. If we go back to science, so let's say all of us, I believe all of us will do the same. If I say, for example, I'm going, for example, I have a tumor, I went to the doctor, although I will meet a human doctor and he will tell me the diagnosis after all full investigations, still I will need a second opinion, although the first doctor was a human. So imagine if you go to a robot or like a robot doctor and he gives you a diagnosis, will you trust him? For sure, you will go for another second opinion. So you will look for a human. So especially for like life-threatening or life-changing diagnosis, robots will not be trusted, even after 50 years. There will be still gap in the trust, building the trust between human and robot. For example, especially for life-threatening diagnosis. But for others, so still like having image repetition, interpretation, anything that has pattern, that will, I think it's coming very soon, within 5 to 10 years. The third thing is medicine is not only like diagnosing and giving treatment. I think you observe this in the clinical practice, where you will see doctors who are just seeing the patient, they are taking very brief history, making the diagnosis depending on their expertise, and then delivering the medicine, and even they don't go and double check on the patient if he's responding or not, and then the patient will be discharged. These doctors should be replaced, for sure should be replaced, because half of the medicine or more than half of the treatment is mainly mental. So you need to work on that, and that will never be done by an artificial intelligence machine. So you need to take history, reassure the patient if there is any like window for reassurance. Even clinical examination cannot be done by a machine. Then the follow-up, what is happening with you? How do you feel today? How is the treatment? Maybe changing the medical treatment or the drug like protocol can be done by a machine. But this reassurance and handshake, tapping on their shoulders and asking them about how do they feel, this for sure what we need to stress on in your training as medical student and as residents. And I think all of you know that story where a patient who was treated in Germany, and a nurse came to him carrying flowers, and she said, "Who will operate on you?" And he said, "Doctor such and such." And she said, "Wow, that's the best doctor in the whole world, and everyone from all over the world, they are coming for him just to let him do the surgery. You are lucky that you were assigned to him." And then when he did the surgery, and it went very well, and after that the bill was very huge, and it says the surgery maybe like 25% of the surgery of the fees were for the surgery, and the rest were for that nurse, because she said that simple sentence. So that reassurance helped him to get better, to trust the doctor, and machines cannot, for sure, cannot do that. That makes sense. So both of you are right. Khadija took the art of medicine, which cannot be replaced for sure, and Hiba took the science of medicine, which for sure will be replaced, and very soon. So let's open the door for questions from people and see how much they capture these informations. Anyone has any question?
You can write your questions in the chat box,
in
please.
the chat, yeah. Or if you want us to enjoy your voice, you can just open your mic.
Hello, this is Lujaina. I want to ask Hiba. Yes?
Yes, Lujaina, you're saying something?
Yes, I just want to ask Hiba something. First, I want to state that I'm not against artificial intelligence, but I just want to ask her if she's having operation. She have to do that operation, and she has two options. She has two options, either to do it by hands of a doctor or a robot. What she will prefer?
Better to ask Khadija and Hiba, both of them. Let's see.
Okay.
Okay. Based on the current situation of how AI is being implemented, I don't trust AI yet. So I'll definitely go for a doctor hand. But maybe sure, when we can trust it more, I can think about it, reconsider it maybe.
Okay, and Khadija?
For sure, doctor. Because whatever will happen then, I can blame doctors, but I can't blame machine.
But do you know what are the benefits that people get from doing surgeries with Da Vinci surgery system?
Yeah, I read about that.
Yeah, it shortened the stay in the hospital, it shortened the blood loss, very less infections, error rate were very much minimized. So if it was me, I will prefer the Da Vinci system. If it is Da Vinci, other systems I will not.
But doctor,
what about
it will
you,
be...
Jaina?
I don't think that I will do it on a robot nowadays. Maybe after 10 years, maybe.
Yeah, but if you have surgery now, you'll do it by a surgeon.
Yes, for sure.
Oh, still not trust, huh? But it's already in practice, by the way, in America and UK, it's already in practice. Very big centers, they have only Da Vinci system. They don't have surgeon.
I haven't
Well, they
done
do have
even
surgeon.
a
Da Vinci will not do
doctor's
it by
hand.
itself.
I can't do it even a surgeon's hand because I'm afraid. So what about robot?
Yeah, but you know, it is not pure robot. So it is only
Yeah,
the
that's
hand.
what I have. Yeah.
It's only the rods. And in the second room, the next room, the doctor is operating everything. So he sees everything in a bigger window and more accurate and more clear picture. I'm trying to convince you, Regina.
Yeah, if I read what is it exactly and I know what they're gonna do, of course, maybe I'll be convinced.
Okay. Fair enough.
Thank
Good.
you, doctor.
Lafu. Okay, any more questions? That is a very good question, by the way. No more? Let me ask a question, similar to what she asked, to Lujaina's question. So if you got, for example, diarrhea and it was not resolving in 5 days, and you contacted, for example, now because of Corona, everyone is doing telemedicine and virtual doctors. Then when you contacted for example, the app, it wasn't a real doctor, it was a virtual doctor. So the response that you are getting is from a robot. And it tells you after the back and forth discussion, like history taking, what is this, what is happening, since when, what are the other symptoms and whatever, it tells you that you have gastroenteritis. Will you trust it? Because it has been 5 days, not resolving, and you found out it's the robot that is responding to you. So will you trust the robot diagnosis of gastroenteritis, although, for example, still you have the symptoms and you think it's maybe something more severe, keeping in mind you are medical students, and medical students are the worst, sorry for that, are the worst patients ever, because they have all the list of differential diagnosis in mind, and they go toward the more severe diagnosis as the one that they are having. They don't go by the simple one at all. Let's say Hiba, who said, yes, it will replace humans. What do you think?
Doctor, they're answering in the chat.
I don't see it.
Yeah,
no, okay.
You can
add second opinion. That's the thing I mentioned. So yeah, people will still need the second opinion, whatever is happening, even in 20 years, second opinion will be there, especially if the first diagnosis was given by a robot. So still, diagnosis by itself will not be trusted from a robot. But skills, anything that needs skills, anything that needs, as I said, image reading, that will be trusted, because human or the patient cannot see what is happening. He doesn't know if a robot has diagnosed his pathology slide, or if an X-ray was read by a robot. But he knows that the doctor in front of me is the one who's making the final decision. So that will remain, for sure will remain.
Hello?
Yes?
Can I add something?
Sure.
I'm
Are
Mir-
you first?
I'm Mirna.
Mirna.
Yes, I study at SQU.
Mm-hmm.
And I just want to add that even without the AI, nowadays, even like if someone wants to ask a doctor, he would go to another doctor and ask for a second opinion, not only between AI and humans, even between doctors.
Exactly.
So a second opinion is needed to confirm that he's right. It's actually needed.
And it is one of the rights of the patient. No one should know for that. Should say no for that.
Yes.
Even
exactly.
for flu, nowadays we see patients who are having corona or simple flu, they will go for maybe 5 or 6 private hospitals or private clinics just to find a fast treatment. So he will not be labeled as COVID. And at the end, he will be COVID.
Yeah.
Yeah, so
okay,
that trust will take a long time to build between human and robot.
Okay, so doctor, we will have a last thing now. Saleh, he will share some information about a research that he conducted.
My friend Saleh. Go ahead, Saleh. I'm excited.
فيكم جماعة، ترى الدكتورة هي المسؤولة عن البحث نفسه.
سوي لنا دعاية أنت الآن.
عشان يعرفوا اهتماماتك دكتورة.
Go ahead.
عندكم الشاشة واضحة؟
واضحة.
يمكن بتكلم بالعربي شوية في النص فاعذروني بالحين. We have conducted this study in SQU. It's about evaluation of the perception, attitude, and readiness of the healthcare providers and medical students toward the implementation of artificial intelligence in healthcare in Oman. Previously, it was only for medical students at SQU, but now it's we reach gladly the next level of our study to become for all medical students in Oman and also for all healthcare providers in Oman. So first of all طبعا يعني تقريبا قلتوا انتم كل اللي انا بقوله في البرزنتيشن مالي بس شويه اعاده. What's the artificial intelligence? It's the ability of computer systems to perform tasks that would usually require human levels of intelligence. And recently, AI experienced an exponential growth across many industries, including, as we talk now about in healthcare industry. So the general aim of AI in medicine is to use computer algorithms to uncover relevant information from data and assist to clinical decision making. So what's the problem facing the AI? Firstly, implementation of AI is in healthcare in Oman is in its infancy due to many factors. Firstly, privacy and confidentiality issues, because as you know, in Oman, we couldn't go to any data of patients due to the policy of sharing data. Also, the sensitivity of healthcare information and data storage infrastructure. يعني كيف نحن نخزن الداتا عندنا وكيف نقدر نتوصل لها، فهذه نفس الشيء مشكلة ثانية عندنا. فمن ضمن also other problems that we have two views of perspectives on AI, as you mentioned previously, pessimistic view and optimistic view. Pessimistic for that for those people who think or believe that AI will replace human, and optimistic view people think that AI will augment human in medical field. It's guaranteed that current medical students and young physicians will be affected by AI before they retire. So they need to become prepared and expert in AI in medicine and use it effectively as a tool in giving healthcare or providing healthcare. This study aims to evaluate the perception, as I said, and understanding of healthcare providers and medical students on the upcoming AI in healthcare, and system structure survey distributed electronically to participants. The method of our study, as I say, it's an online survey, and it's consisted of questions regarding the recognition of AI, attitude toward AI, and development direction of AI in medicine in Oman. This project approved by SQU from the College of Medicine Ethical Committee in our college. Other healthcare providers in Oman will be included in the next level, inshallah. We have reached this level, but still there's some يعني شوية خطوات لنوصل للمرحلة هذه. Here's some results على الريسبونس اللي وصلت لحد الحين. As you see here, medical students respond and also healthcare provider. When we come to medical students, most of medical students are in senior preclinical اللي هم على phase 2 عندنا في الكلية، وفي الانيو عندهم في السنة الرابعة. The healthcare providers mostly certified physicians who respond to this survey and answer the questions in the survey. Here, there is a comparison between the answers or the beliefs of healthcare providers and medical students. And as you see here, في شوية يعني توافق في الآراء بين medical students and healthcare providers. يعني they both believe that the great usefulness of AI in future healthcare will assist the clinical diagnosis and decision making, and also will speed up clinical judgment. But they differ in the belief in AI will create new position, as medical students will not believe in that. So in conclusion, majority of participants and especially the medical students have a good attitude toward the application of AI in future healthcare system, and they are very enthusiastic to learn more about AI through courses and workshops, webinars, whatever. There is dire need to incorporate AI in medical education as a course to ensure that future doctors will have a solid familiarity for the new technique that were and their application of AI in medicine. So thank you for your listening. Hopefully it was clear, and if you have any questions, please don't hesitate to ask me. Just open your mic or write it in chat. بس جماعة أريد منكم تعبوا لي هذا الاستبيان. برسلكم الرابط الحين. وصلوا الرابط في الشات وما عليكم أمر يعني. يبقى اقترح أصل الشات يا جماعة.
راشد من فوق بتحصل الشات. اوكي
علينا اصلا. اذا عندكم اي سؤال feel free to ask. وعبوا لنا الاستبيان لو سمحتوا. طبعا نسيت اخبركم انه يعني دكتور عذاري هي صاحبة الفكرة. قلت في البداية بس فقط في البرزنتيشن.
شكرا صالح. Very good presentation. So I have two things to say here. One is College of Medicine في SQU and OMSB, they are preparing AI in medicine courses. So inshallah once you go for training في OMSB, inshallah you will have that course, and you will have, since you already know all of this, it will be more of technical. Second thing, I want you to implement AI-oriented mind. So when you go and practice for your clinical years or after graduation, whenever you do any work or any like task, try to figure out, can this be automated? If it can be automated, you can either like work on it as a research, or you can contact an AI person who can help you to automate it. So maybe with your support, because you will be facing a lot of like tasks that can be automated, but no one is like thinking toward automation. They think this is the default and this should go as it was. So you should be like changer, like you want to make a difference, and believe me, you will be shocked that a lot of people, consultants, senior consultants from all medical fields, who are not aware of AI, or maybe they know very superficial things about it, and they don't know how much it can help them to save their times. So a lot of paperwork, a lot of tasks that can be automated. So please, if you go there, you will be like ambassadors for AI. So whenever you feel that any task you are doing is laborious, it takes a lot of time, and it is a lot of repetition. So we are here to help. Either you conduct it as a research to figure out, is it cost effective? Is it worth it or not? Second, you can contact AI people, and our SQU is full of people who are interested in AI in medicine, and they are willing to help. We can contact them, give them the data, and they can give us any algorithm to implement it, and that will save a lot of time and effort. So just make your mind AI or automation-oriented mind to find these gaps in order to solve them.
Thank you, Dr. Adhari. So coming toward the end, I would thank Dr. Adhari for providing us with valuable information and also for being a part of our event. I would also like to thank Khadija, Hiba, and Saleh for their great effort.
شكرا ميان. I would like to thank you ميان. بالتوفيق وأسامة والجميع وكل الفريق. اليوم آخر يوم لكم.
أيوه.
بالتوفيق إن شاء الله. It
شكراً.
was very well organized event.
Thank you, Doctor.
بالتوفيق.
Sorry, I wasn't. Thank you, Dr. Adhari. For who didn't still use the link or found a problem, you can scan the link from here. And please, all participate. It won't take. It will take less than 5 minutes. Thank you.